Jumoke. So today we'll be talking about drug nutrition interaction. So recently there have been different claims about some medication interacting with certain food. So today I have a pretty guest doing justice on that. So I want her to introduce herself fully.
Hi everyone, my name is pharmacist Fumi Ajao. I'm a chief pharmacist at Aurelia General Hospital, and it's good to be here.
Yeah, thank you for coming. Okay, so now let's get straight right into it. So recently I've been seeing different claims about malaria drug interacting with vitamin C supplements and the fruit as a whole. So I want you to shed more light on it. So there are some claims that when you take it, it could damage the organs of the system, and there are some claims that when you take it, then there's nothing that is fine that you can take both together. So I want you to do justice on that.
Okay, thank you. So anti-malarials, we have various anti-malarials in the market and in circulation. But the first line treatment for treatment of malaria that is accepted by WHO is an artemisinin-based therapy. So we call them ACTs, right? So artemisinin combination therapies, and one of the most commonly used ones, especially here in Nigeria, is artemether-lumefantrine. So artemether-lumefantrine we have in brands like Watem, Amatem. There are so many out there. We have other artemisinin-based combination therapies like dihydroxy, artemisinin, and peparaquine. We have those in the likes of pialaxine, ipassinate, and the likes. And then we have some monotherapies. Like, in the past we used to have artesunate, and they realized that it wasn't as effective in the clearance of the malaria parasites from the system as opposed with the combination therapies, and that's how ACTs came to be. So we also have, there's a brand that is called Serum, and that's aterolone, if I'm right. And yes, most times most people have different most of these drugs have various mechanisms of action, and that is how effective, it determines how effective they would be in neutralizing or eradicating the malaria parasites from the system. Well, let me focus on artemether-lumefantrine, because that's the one that's the commonly used one, and the one most people have issues with when they start talking about the vitamin C's, which is ascorbic acid, and that is why it goes beyond just saying the vitamin C tablets that we know. We also talk about the fruits, which is, we have ascorbic acid in most of the citrus, to make sure that the patients understand that we are not asking you not to make use of vitamin C. You see, funny enough, when doctors prescribe artemether-lumefantrine, a doctor that knows his onions knows that you have to prescribe vitamin C alongside. You see, vitamin C is not a bad drug, it's not a dangerous drug. It's just that at the time when you are taking the artemether-lumefantrine, which is actually for 3 days, after the 3rd day, you can commence the usage of your vitamin C.
Okay, so that's after the 3rd day.
After you are done with your dose of artemether-lumefantrine, which it is actually beneficial for the patient to make use of vitamin C after completing artemether-lumefantrine. What the malaria parasite does to the host, to the body, is that it causes oxidative stress. That is the mode of operation of malaria parasites. They cause oxidative stress on the host. And we know that ascorbic acid is an antioxidant. Anti-malaria. You actually make use of ascorbic acid to help you mop up any other free radical, any other oxidation or the stress caused on the host by the malaria parasite. to actually then help your body rejuvenate better.
Okay.
So it is after your dose of anti-malaria that you should commence the vitamin C. The reason why we don't like it being used is that, you see, there's the way the artemisinin-based drugs work in eradicating malaria parasites from the system. There's a ring where when the anti-malaria activates its action, we want it to happen at the later stage, at the end stage of the malaria, they call it the cycle.
Okay.
We want it to happen whereby it will actually make its effect at that stage, not before. You see, when you use vitamin C alongside, it's like I'm trying to make I wish I have
Break it down.
yes, the structure,
Okay.
of the malaria parasite, and then the structure of the artemisinin chemical structure. You don't want it to happen before it gets to the site
Okay.
of action.
Action.
You don't want that process of where vitamin C actually activates a particular ring for, and it is like an epoenzyme exploding. You don't want it to happen before it gets to the site of action. You want that outburst to occur at the site of action. So when you make use of vitamin C with it, it inhibits the efficacy of the drug, because only a little of the concentrated artemisinin gets to the site of action, and then before you know it, your work is not, the drug is not effective, because it's not getting to the site of action before it actually works on the malaria parasites. So only little content of the active ingredients gets to the site of action. So that's why you read it sometimes. Some people say it's better to take it with vitamin C, and then some other studies is saying that you shouldn't take it with vitamin, because we are reading in parts.
So they don't really understand the full structure.
Yes, you need to understand the benefit of ascorbic acid on the host when you have malaria or you've had malaria, and you also need to understand the work of vitamin C on the artemisinin drug. So it is beneficial to the host to make use of ascorbic acid at the end of artemisinin therapy, not during the therapy, so that it will not reduce the effectiveness of the drug beyond calcium.
Okay.
So that's why we all actually say
the same malaria drug. Wow.
So that's why we say stay clear of multivitamins or fruits while you are on ACTs. Be through with your 3 days therapy before you commence the use of taking fruits or multivitamins. And I think another drug that doesn't preach this interaction is the aterolone, which is the serum. They say their own entity doesn't get affected by vitamin C because it is not an artemisinin based drug.
Okay.
It is another drug entity. It's different from artemisinin based therapy. So that is why they claim that you can make use of vitamin C when you're on their own drug. Yes.
All right. So there you have it, guys. Thank you very much, AJ, like I do call her. We have it. Our guest has said a lot. So now we've heard and we've learned that you can take our vitamin C even in form of fruits or as juice or supplement at the 3rd day of using, that's after using your medication. So do not take it don't take your vitamin C while using your medication, especially your malaria drug. All right, so there's a bonus question I would love to ask my guest here. So now let's go into the beauty aspect. We have this vitamin C facial serum.
Okay.
Facial serum, does it really work, especially the vitamin C? Does it really have an effect like on the skin than taking the fruit as a whole? So I want to know your take on it.
Well, like the effect of vitamin C serum,
Yeah.
as preached by skincare experts, is that it has a brightening effect. Um, I am not
A brightening effect, and it slows down aging. That's most of the adverts.
Okay.
Yeah, it slows down aging.
Well,
because we know that the antioxidant helps in the
removing the
free radicals that
from the
yes,
skin. I want to believe that when it comes to skincare, I'm an advocate that you give your skin time to heal. Because whether you use anything or not, your skin regenerates between 6 weeks to 6 months. It depends on how
6
old.
months.
Yes,
That's a long time.
yes, you need to give your skin time. If you have a mark on your body and you apply these things, it might speeding up the time the scar might be not heal now, clear. You know, we are talking about clearing. You know, the vitamin C serum is supposed to have a clearing effect, brightening effect. But if you still don't put it, your skin will regenerate. It sheds off the dead cells. Now, it's on the things that can slow down the process of regeneration: ailments, age, weather.
That's
Depends on, yes, but well, regardless, your skin will shed. It can just take a longer time depending on these factors I just spoke of. So if you take fruits internally, yes, it might take a longer time before, you know, your body, you see the physical effect, as opposed to the topical effect of actually applying it on the skin organ. You know, our skin is an organ. So if you want it to happen fast and quick, yes, topical. But if you want it to happen slower but longer, you want it to retain that brightness, you want it to retain that elasticity, you want it to retain that beauty, you should wait for it. Is what you take it that will last longer.
All right.
Yes.
Thank you very much for that answer. So guys, thank you very much for listening to today's topic. I hope you enjoyed it. Kindly subscribe to this channel. Thank you very much. God bless.